Hello, this is Osama Amrani. Today I will talk about urinary tract diseases, UTD. Ever wondered how common urinary tract diseases are and how they can impact your life? Imagine a world where a simple task like urinating becomes a daunting challenge, where the silent threat of kidney failure lurks in the shadows, ready to pounce. Consider the agony that kidney stones can inflict, and the unseen enemy that is a bladder infection. These are just some of the realities of urinary tract diseases, common yet often misunderstood. Stay tuned to find out more about these common yet often misunderstood diseases. Urinary tract diseases are more than just a nuisance, they can have severe health implications. Let's delve into the world of urinary tract diseases, a realm that includes conditions such as kidney stones, kidney failure, and bladder infections. Kidney stones are hard deposits made of minerals and salts that form inside your kidneys. They occur when your urine contains more crystal-forming substances like calcium, oxalate, and uric acid than the fluid in your urine can dilute. Symptoms include severe pain in the side and back, pain on urination, and pink, red, or brown urine, among others. The health impact can vary from discomfort and pain to kidney damage or failure if left untreated. Next, we have kidney failure, a serious condition where the kidneys lose the ability to sufficiently filter waste from your blood. This can be caused by conditions like diabetes, high blood pressure, or certain genetic conditions. Symptoms are often subtle and may include nausea, shortness of breath, fatigue, and confusion. Untreated kidney failure can lead to a buildup of wastes and toxins in your body, causing severe health issues and ultimately can be fatal. Last on our list for today is bladder infections, also known as urinary tract infections or UTIs. These occur when bacteria enter the urinary tract through the urethra and begin to multiply in the bladder. Symptoms include a strong, persistent urge to urinate, a burning sensation during urination, and cloudy urine. If left untreated, bladder infections can spread to your kidneys, leading to kidney infections which can cause permanent damage. The potential impact of these diseases on health is immense, affecting not only the urinary system, but the entire body. They can lead to severe pain, long-term damage to the kidneys, and in extreme cases, can be life-threatening. However, the good news is that understanding these diseases is the first step to prevention and treatment. Through knowledge, we can take measures to maintain our urinary health and prevent these conditions from taking a toll on our lives. Remember, health is wealth, and a well-functioning urinary system is a significant part of that wealth. Understanding these diseases is the first step to prevention and treatment. Imagine having a stone, not in your shoe, but in your kidney. Now that's a bit of a jarring thought, isn't it? Kidney stones, unlike the pebbles you might find on a beach, are crystalline lumps formed from substances in the urine. They're like unwelcome tenants in your urinary tract, making their presence known through a symphony of discomfort. The size of these stones can vary from that of a small grain of sand to a golf ball. And believe it or not, some kidney stones have been found to be even larger. The origins of these stones lie in various culprits. Factors such as not drinking enough water, certain diets, and specific medical conditions can lead to their formation. And the symptoms? They're as pleasant as a kick in the shin. Sharp pains in the back or lower abdomen, blood in the urine, and frequent urination are just a few of the delightful experiences one might encounter. But don't lose hope just yet. Treatment options are plentiful. Drinking lots of fluids can help pass smaller stones. For larger stones, medical procedures like extracorporeal shockwave, lithotripsy, or ureteroscopy can be used to break them down or remove them. In some severe cases, surgery may be necessary. So take care of your kidneys, folks. After all, they're the only ones you've got. The pain of a kidney stone is something you wouldn't wish on your worst enemy. Kidney failure, a silent threat, often goes unnoticed until it's too late. It's a chilling reality that's worth understanding. So let's delve into what kidney failure truly means. Kidney failure, also known as renal failure, is a condition where your kidneys lose their ability to function properly. You see, your kidneys are your body's natural filtration system. They clear out waste and excess fluids from your bloodstream. When they're not working as they should, these wastes and fluids build up, leading to a myriad of health complications. But what causes this silent threat? Well, several factors can contribute to kidney failure. Chronic diseases like diabetes and high blood pressure are common culprits. They slowly damage the kidneys over time, making it harder for them to do their job. Other causes can include certain autoimmune diseases, genetic disorders, or severe infections. The symptoms of kidney failure are often subtle, making it a silent threat indeed. These can include nausea, fatigue, shortness of breath, and even confusion. Many people mistake these signs for less serious conditions, allowing the disease to progress undetected. And here's where we underline the importance of early detection. The sooner kidney failure is identified, the better the chances of managing it effectively. Regular checkups with your healthcare provider, especially if you have a chronic condition like diabetes or high blood pressure, are crucial. So, what happens if you are diagnosed with kidney failure? Well, treatment options vary depending on the severity of the condition. Dialysis, a procedure that replicates the function of the kidneys, can be used to filter waste from your blood. In more severe cases, a kidney transplant might be necessary. Remember, prevention is always better than cure. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and staying hydrated, can go a long way in keeping your kidneys in good shape. Kidney failure is a silent but deadly disease. Early detection is key. So let's be vigilant, take care of ourselves, and remember the significance of our kidneys in our overall health. Bladder infections, the unseen enemy, can strike when least expected. Commonly referred to as cystitis, these infections are a type of urinary tract infection that primarily affects the bladder. They are usually caused by bacteria that enter the body through the urethra and travel up into the bladder. While bladder infections can affect anyone, some people are more susceptible than others. Women, for instance, are more prone to bladder infections due to their shorter urethra, which makes it easier for bacteria to reach the bladder. Additionally, individuals with weakened immune systems, such as those with diabetes, are also more vulnerable. The symptoms of bladder infections can be varied and often unpleasant. The most common ones include a burning sensation during urination, a frequent urge to urinate even when the bladder is empty, lower abdominal pain, and cloudy or strong-smelling urine. In severe cases, blood may be present in the urine, and the individual may experience fever and chills. Bladder infections are typically diagnosed through a urine test, which can detect the presence of bacteria, white blood cells, and red blood cells. If you're experiencing symptoms of a bladder infection, it's crucial to seek medical help promptly to prevent the infection from spreading to the kidneys, which can lead to more serious health complications. Treatment for bladder infections usually involves antibiotics to kill the bacteria causing the infection. In addition to medication, it's important to drink plenty of fluids to help flush bacteria out of the urinary system, and to avoid irritants such as caffeine, alcohol, and spicy foods, which can aggravate the bladder. While it's not always possible to prevent bladder infections, there are steps one can take to reduce the risk. These include drinking plenty of water, urinating regularly, and for women, wiping from front to back to prevent bacteria from the anal region from spreading to the urethra. Bladder infections are common but can be serious if not treated promptly. So, remember, if you're experiencing any symptoms, don't hesitate to seek medical help. So, what have we learned about urinary tract diseases today? We've journeyed through the often overlooked world of urinary tract diseases, diving deep into the realms of kidney stones, kidney failure, and bladder infections. We've uncovered that these conditions, while seemingly disparate, are interconnected in the grand tapestry of our health. Kidney stones, those painful crystalline formations, remind us of the importance of hydration and dietary vigilance. We've learned that high protein, salt, and sugar diets can contribute to stone formation, and that drinking plenty of water is not just good advice, it's a lifesaver. Quite literally, it can be the difference between a healthy urinary tract and one plagued by stones. Next, we delved into kidney failure, the silent threat that lurks undetected until it's often too late. We've emphasized that early detection is key and that regular checkups can help identify issues before they progress. Chronic kidney disease isn't always symptomatic, and that's precisely why it's so dangerous. It's a silent predator that can be thwarted by regular screenings and a healthy lifestyle. Finally, we explored bladder infections, the unseen enemy that can wreak havoc if left untreated. We've underscored that hygiene plays a pivotal role in prevention, and that prompt treatment is crucial to prevent complications. Antibiotics are typically the first line of defense, but prevention, as they say, is better than the cure. In essence, prevention and early detection are the twin pillars that uphold our battle against urinary tract diseases. They underscore the importance of being proactive about our health. After all, our bodies are our most precious possession, and taking care of them should be our top priority. So let's not ignore the signs our bodies give us. Let's stay hydrated, eat healthily, maintain good hygiene, and schedule regular health checkups. Let's arm ourselves with the knowledge to identify these diseases early on and take the necessary steps to prevent them. Remember, knowledge is power. Stay informed about urinary tract diseases to protect your health.